Caribbean and African doctors. These health hours are all about empowering, educating and giving space to black people so our communities can look after themselves better. Every Saturday, our black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems such as pharmacists, specialist nurses and many faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual and racial challenges, men's health, respiratory problems such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and sessions mental health, heart health, women's health, reproductive and sexual and racial challenges, men's health, respiratory problems such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and sessions mental health, heart health, women's health, reproductive and sexual and racial challenges, men's health, respiratory problems such as pharmacists.
Hello and good morning, everyone. And if you were just listening to that introduction, I'm sure you're wondering what's going on. It seems that the audio wanted to give our intro so many times because it's so good. So thank you so much for persevering. So again, good morning and welcome. This is Khan's Health Hour. And as ever, I'm giving a huge welcome to our regular listeners and also welcoming those who are spending time with us for the first time. My name is Rabia, and your host today. And before I just want to try our results. It's a safe space for learning and education, and it's for you, and it's for everyone in your network, in your family, in your friendship group, in your support network, your colleagues. It's a space that we share health, knowledge and awareness about a whole host of conditions and experiences that can really affect our health. And the key thing about it is that, as I've said, it is for you, and it is for you as human beings, and it is for you as members of the African and Caribbean communities. And so we know that there is really important aspects of our care or spaces that we will feel safer when we are hearing information from people that look like us. So every Saturday morning at 11 a.m., so many colleagues, medics, nurses, specialists across health come to you to share their knowledge. And so feel free to listen and engage and ask questions as you'd like. What we normally do is that as we go through, as the speaker is speaking, please connect with us in the chat, and then we'll go through all the questions at the end. But also, it would be fantastic if some of you would like to come online and ask your questions directly, because we are a community here. And it's also really lovely when you let us know where you're listening from and who you're watching with. So just to note, please be aware that we are recording, and so that you can watch again at any time, but also share the link with your networks. So if you don't want to be seen, please do turn your cameras off, but we would love to see you. As I said, we are a community and it's always lovely to speak to people's faces, but please do whatever is comfortable for you. But without further ado, I feel awkward about introducing Dr. Joe because he is a regular partaker on the Khan Health Hour, and in fact part of the Khan family. And I'm going to let Dr. Joe really introduce himself more fully of the work that he does, but also specifically about the topic that he's going to be speaking about today. Before we started, we reflected on how vast the topic is. And so you would have seen that it said the importance of your mindset in recovery. But I know that Dr. Joe will talk to us about how that can cover a whole host of things. So without further ado, I will hand over to the fantastic Dr. Joe, who will take us through his slides and perspectives. Over to you, Dr. Joe.
Thank you, Vanessa. Thank you very much. I think I should get you to introduce me every time I go somewhere to speak, because you're
I'll
extremely
be there.
kind. Good morning, everybody, and I'm so glad to be able to join you once again. Like Vanessa alluded to, I quite regularly come over here once a month, thereabout. I'm a GP here in Manchester with a special interest in mental health and also in skin. And I do minor surgery and remove lumps and bumps and things like that. I'm also the mental health lead for CAN. I do that on a voluntary basis. I am John Maxwell certified coach and mentor. I am a motivational speaker. I am privileged to pastor a church. I'm a husband and a father. All right, so that about covers everything. I have a few other titles that I will not add on today, but so we'll leave it there for now. Today we want to talk about how the fascinating link between the mind and the ability of the body to recover. So as I pondered on this subject, I realized that it's a very, very vast and really really big topic. So if you will bear with me today, we can only sort of scratch the surface, as it were, on this very important subject. So I will lean very heavily on you asking us questions that may be pertinent to your specific situations or areas where you may want us to cover. What I have tried to do is to give a broad overview on this very important subject without going into too many specifics. So if you bear with me over the next 15 or 20 or 25 minutes, I will share a few slides with you. Thank you. Right, so let's put this here. Right, so that's what we're going to be talking about, the fascinating link between mindset and recovery. So basically, in 1948, the WHO defined health as the presence of well-being, physical, mental, and social, and not necessarily the absence of disease. This was one of the, perhaps in modern times, the very first time that health was being separated from just physical ailment. Now the WHO redefined it to include mental and also social aspects of our health. And this is really important because most of the time when you think about doctors or health professionals, what we think about is our physical well-being. And as I've often said here, one of the reasons why mental health is difficult both for patients and for doctors to be able to deal with is for a number of reasons. Number one, there is this perception, there is this stigma that, that about mental health. If a patient or if someone is bleeding, we can all see they're bleeding, and so we know that there's something wrong with them. If someone runs a temperature, you know that there's something wrong with them and you want to help them. Most of the time, when it comes to illnesses of the mind, it often requires further perceptive abilities, subtle things that really you need to go a little bit further. And so it's difficult, both for patients and for practitioners, to be able to deal with things that surround the mind and indeed mental health. Galen, one of the fathers of medicine, he influenced the thinking of modern medicine for over 1,300 years. And so it's worth mentioning. I will also quote Socrates, or Hippocrates rather, the father of modern medicine. Galen opined that only 20% of patients who came to him had some sort of physical basis for their illness. And this is as far back as 130 AD, thereabouts. He said to have lived between 130 AD and 210 AD. That's long, long, long ago. More recently, a survey of general medical clinic patients found out that suggested that only 16% of their complaints were actually explained by what was going on physically. Now, that's really important. I've said here that our minds can be our worst enemy, but also can be our best assets, depending on how you look at it. And as far as this topic is concerned, there's still a lot of ongoing research. However, a lot of consensus has been made. For example, in the 17th century, for the first time, they made a delineation between the mind and the body, which was then accepted by the entire medical community. But only in the 1900s was the concept of a human being being made up of spirit, soul, and body actually embraced by the medical community. Hippocrates that I mentioned earlier on he had a lot of quotes that a lot of doctors use. And I like to look at these old guys because we learn from them. The thing about medicine is that because patients often ask me that, why is it that we were giving certain advice 20 odd years ago, but now the advice has changed, this time around? The reason being is that medicine is an evolving art. We keep on learning, we keep on growing, we keep on improving. And so the advice that was valid, for example, 30 odd years ago, 35 years ago, when I was in medical school, we've learned that some of those things are no longer valid today. And so the advice also will then have to change. And so sometimes even as far back as 5-10 years ago, what the advice was on certain things have also changed. So it's really important to recognize that medicine is progressive. The other thing I should say as a disclaimer is that in the UK, unlike certain parts of the world, unlike, for example, America, we practice what is called evidence-based medicine. So I can't just, as a medical practitioner, come out and say anything. I'll give you a good example. During the COVID pandemic, and when people were talking about the COVID vaccines and things like that, people were producing videos from practitioners in the US. Because the United States is actually a conglomerate of different states, and different states have different laws, which are not necessarily representative of the whole country. And they were making certain comments, and some of them derogatory comments about this. I challenged some people who brought me those videos to find a UK doctor who would say anything like that, and they couldn't. The reason being is that for you to be able to make any claim here in the UK, you have to have solid evidence behind you. Otherwise, you might find that your license is stripped from you. So all the things that we're going to be talking about here is evidence-based. A good example of someone who fell foul of this is the guy who talked about the MMR vaccine. I did Andrew Wakeman or something like that. And he influenced a lot of people to thinking that the MMR vaccine was not helpful. And he got stripped of his ability to be able to practice here in the UK. So Hippocrates said it's better to know the patient who has the disease than it is to know the disease which the patient has. This is deep. Right? Think about it for a few seconds. It's better to know the patient who has the disease than to know the disease which has the patient. Some of my patients, when they come to me nowadays, because I'm so familiar with them. For example, yesterday, I had a telephone consultation with a lady from Albania. Now, I just realized upon reflection that I have managed this woman and her family for about 8.5 years. And every time she comes on the phone, even though it's her own appointment, she'll talk about herself, her husband, her children. And also, I know that when I'm speaking to her, even though she had a 10-minute slot, that 10-minute slot, actually, telephones are 5-minute slots. Even though it's a 5-minute slot, I'm preparing myself mentally for a 15 to 20-minute conversation because I know the patient. Also, I happen to know that she suffers with a lot of anxiety. So today she'll complain of leg pain, arm pain, and all of that, and she thinks she's dying. And I'm not being derogatory. I'm just saying that I know the patient. And because I know the patient, the disease that whatever she's suffering from is less intimidating and less of a problem. All right. So if we go on, right. According to Professor Ray et al. In the Journal of American Psychology, 2004, he said that the brain is the body's first line of defense against illness. The brain is the body's first line of defense against illness, and the mind is the emergent functioning of the brain. So this mind-body approach incorporates ideas, belief systems, and hopes, as well as biochemistry, physiology, and anatomy. Therefore, changing thoughts imply a changing brain, and thus a changing biology. Let me break it down for us. Basically, you have to take into context what a patient's spiritual beliefs are, what their emotional beliefs are, what their hopes are, and we need to understand the fact that all those beliefs actually affect their physiology and they affect their physical well-being. For example, in the Afro-Caribbean community, we're very, very spiritual. So when a patient tells you that he or she believes that his problems may be demon originated or witchcraft originated, rather than shoo-shoo it or poo-poo it, it's important to understand that that belief, whether right or wrong, is actually influencing the way she responds to your treatment. So most of the time, a lot of people get disillusioned because when you come to in the UK or to the average UK doctor who doesn't necessarily believe those things, they then feel that they're not being listened to, then feel that they're not being heard, they then feel that they're not being understood. And so they go away disappointed because those beliefs are held very, very firmly. In fact, they've grown up with it. They grew up in church or in a mosque or in a temple. They grew up with it. So for you, who are you now to come and tell them, you know, that there's no such thing as demons or witchcraft, etc. And so it's really important to incorporate how all these things. And also, I did a talk some time back on psychosomatic illnesses, basically illnesses of the mind that affects the body. It's well established now that certain illnesses like IBS, your mind contributes to its exacerbation. So people who, when you get stressed, when you get upset, when you get worried, your symptoms become worse. That's well established. So there's a mind-body approach to how we deal with things. And some of it stems from our belief systems, our hopes, and it definitely affects our physical body. Let's just talk a little bit about the brain for 2 seconds about this. So by and large, you have different parts of the brain. I won't bother you all of them. What I want you to focus on is the big part called the cerebral, all right, or the cerebral cortex. This is where a lot of things happen, all our cognition. In fact, it's in the cerebral cortex that you find what is called the higher centers. The reason why we are different to animals, this is one of the many things that separates us from animals, apart from the fact that we have a bigger brain. So the bigger your brain, the more intelligent the species are. That's why when you hear somebody call somebody fish brain, it's a huge insult because fish have a tiny brain. That's on the side. I'm often amused when I hear people throw insults at one another, especially husband and wives, just on a lighter note. Somebody says, "Oh, you're very stupid." He said, "Yes, it's my stupidity that led me to marry you." You know, and you know, when you hear some of these exchanges, you just imagine how people's brains are working. You know, another one said that, "Oh, look at that person. They look, you know, he saw an animal and said, are those animals related to you?" He said, "Yes, they are related to me. They are my in-laws." You know, so the brain is a very interesting way of working. And it's very interesting how people deal with things. So, but in the brain, you have the cerebral cortex where you have higher functions. So I was saying that the difference between our brain from animals is the fact that A, it's bigger, but also we have what is called a higher center control. So you don't often just give into your animalistic tendencies. You don't just see food on the road and grab it on the ground, you know, dead food or, you know, dead animals or dying animals like other animals do. There's a higher function that tells you that this thing may be decaying. This thing could be harmful to me. You know, you don't just see somebody else's property and go grab it and say it's mine. There's a higher function that gives us sort of control, as it were. And you only find that in certain, you know, animals like primates, apes, you know, baboons, things like that. And of course, humans, even whales and other animals that have bigger brains. The bigger the brain, the more intelligent. Think about it. That's one of the reasons why you can train dolphins, because they're very intelligent because they've got big brains. So that's having been said, cerebral cortex controls higher functions, the ability to have memory, the ability to make judgment, abstract thinking, creativity, social appropriateness, etc. You know, you don't just see a woman on the road and grab her by the waist and say, "You are mine." You know, somebody's going to get arrested. Or if she has a husband, you might get punched very hard in the nose. So it's important to understand how the brain works, because what we feed to the mind is very important. And this helps how the brain develops. Now, I want to go into an area that may be a little bit political, as it were. Physical injury, emotional traumas, abuse, poor nutrition can affect how the brain is developed and therefore how well the mind functions. So when you think about children, it's very important that children have good brain development from when they are young. Because if you don't give them good nutrition, the brain is not going to develop well. If they are abused, the brain does not develop well. That's why a lot of times, most of the people who are in the criminal justice system, people who are serial killers or narcissists, when you trace their childhood back, most of the time they've been abused emotionally, sexually, physically, some way. And that has done something to the wiring of the brain that now makes them think that violence is okay. That is a very simple explanation for a very complex issue. As a matter of fact, I think, and this is just me, I don't think there are smart people and dumb people. I think there are exposed people or educated people and non-educated people, because I sincerely believe that all of us have the capacity to excel once given the right environment. Think about it. A child that goes to private school from the start, gets exposed, goes to school trips, goes to Spain, goes to Canada, goes and sees different things. The ability to be able to think, the more you expose their brain to, the more, that's a very funny thing about the brain, the more the brain cells multiply and the more the capacity to be able to have abstract thinking. So their brains start getting bigger and wider and they appear to be smarter. It's exposure and education. So this is why, for me, I even think, like I said here in one of my, I said here, bridging the socioeconomic divide in any society, to me, is just as important as administering medication. Because when we do that, when we bridge that gap, we then raise individuals who have hope, who have prospects. If you raise individuals that have no hope, no prospects, who have a low self-esteem, low mindset, you are setting them up for failure automatically. Doesn't matter how good they are, but because they think they are not good, they automatically fail. And this is why, for us, it's very important where you send your child to school too. And please, Black parents or Black ethnic minority parents, be involved in what's happening in your children's school. Because most of the time, unfortunately, in Europe, and not just in the UK, many people what's that thing now? Already we're labeled. Some people actually think Black kids do not have the capacity to excel. I've seen teachers, whether in Word, because I used to be a school governor as well. I resigned recently. I was too busy. Some people actually think that Black children don't have the capacity to excel. Why? Because they're Black. So, and that, unfortunately, again, because of that's their own experience. So when they see you, when they see me, who were doing things, and you think, we buck the trend, as it were, then they begin to think differently. So part of my life plan, part of my life, as it were, purpose is to change people's mindset, especially about Black. I want to create a better world for my children. I don't know about anybody else, but I want to create a different world for my children. I want them to be perceived differently. That's just by the by. It's part of what I do. I do youth mentoring. Again, I do it completely free. I find time to do it because I believe it's an investment. You train the young minds for today, they become better people tomorrow. So things like drugs, alcohol, substances, they can contribute to the poor development of the mind. So children, individuals who are exposed early to some of these things can often find out that their brain is not as well developed. There's even something called fetal alcohol syndrome, where when a mother drinks too much, it affects the brain development of the unborn child, where the brain shrinks and they have mental retardation, etc. It's a totally different thing. I'll leave that with my pediatrician colleagues to delve into. It's well documented that positive environment breeds positive individuals and vice versa. By implication, our minds will succumb to the information presented to it until new and better information is presented. Henry Ford said this, the guy who makes Ford Motors. He said, he who says he can and he who says he can't are usually both right. If you say you can't do it, you are right. If you say you can do it, you are also right. Why? Because it's in your mindset. It's what you believe. If you believe you can do it, then you can. And if you believe you can't do it, then you can. Let's look at some scientific evidence, shall we? So back in 2001, this is going back, 23 years, something like that. So a more optimistic, I want to just set the tone because there's a lot of things we could say about it, like I said at the very beginning. But I want to give this very broad strokes and just, leave you to ponder a little bit and maybe go into some Q&A when the time comes. I hope Dr. Vanessa is looking at the time, because I talk for a living. I can talk for England, Scotland, and Wales.
I am, don't worry.
And even Azerbaijan, if you let me. So a more optimistic explanatory style of viewing the glass of half full. Can you imagine? Just being positive lowers the risk of cardiovascular heart disease in older men. This is done, a paper that was done 23 years ago. And you can go check them out, Kubansky, Sparrow, Vokonas, and Kawachi. And a more optimistic idea, viewing the glass as half full, reduces the risk of heart attack. A 30-year study reported that a pessimistic explanatory style significantly associated with higher mortality. This is done by Maruta, Colligan, Malogan, Oxford in 2000. A lot of studies have shown that if a patient is positive before they go into an operation, into a surgical operation, the outcome is more likely to be positive than if they're going with a pessimistic approach. So what we're talking about today is how the mind affects recovery. So really, what a lot of times what they're doing now is making sure that pre-operatively, people are primed. They explain to them the positivity. It's so important to be positive about what the operation is going to be, how things are going to be, etc. So that you don't come back. So how else does having a positive mindset affect you? Having a positive mindset has been shown to actually affect your immune system. It makes you more able to fight infection and disease. This is massive. Being positive helps you to be able to fight infection. It affects your immune system, and the reverse is the case. You're very negative, you find out that you're susceptible to infection. This is why a lot of times when we are stressed out, if you think about it, or you think about people around you, when you are stressed out, going through a divorce, separation, job loss, that's when you're more likely to catch a cold. That's when you're more likely to fall ill, because it just becomes, oh, it's too much, it's too much, it's too much. So that positive mindset helps to shore up your immune system. Like I mentioned, there's better recovery from surgical operations, better compliance to taking medication. Some research found out that up to 30%, sometimes this is maybe even more, of people we prescribe medication to do not take their medication at all. The one that I often cite is a gentleman that I went to visit a few years back. And I got to his house and he had 6 months worth of medication piled up. I asked him what medication was he taking. He said, come. Lovely gentleman. He had 6 months worth of medication. I was like, what's been going on? He said, well, they keep on bringing them and I really don't like the taste of it. So, it's in the cupboard. So about 30 to 40% do not even take the medication at all. So even when we think we are prescribing for people, when we think we're giving them the best advice, people don't. I often joke to my patient that only my mother listens to everything that I say. Only my mother. And maybe my youngest daughter, maybe. But everybody else is fair game, So by and large, having a positive mindset is also very important for your mental health. That goes without saying. It's very important. We don't have time to delve into it. In previous talks, we have looked into it intricately, how being more positive affects your mental well-being. It has been found, like I mentioned, to reduce cardiovascular disease and stress. So what are the action points? What are the things that we can do to actually help make things better? Can I just start from the bottom of my slides to say that we need to let go of past hurts. One of the things that I've found, and I don't know who I'm speaking to, but this was really laid very strongly in my heart. You need to heal from past experiences. If you paint the people in your present or your future with your past hurt, you will simply cause more damage. And I've often said this in my talks, hurting people hurt people. If you're hurting, you're more likely to hurt somebody else. Have you been in a relationship? Well, I do relationship counseling as part of one of the many hats that I wear. And very often you see husband and wives going at each other. What I found is that people bring baggage, either from their past or from past relationships. David has no clue what is going on. But because Shannon has been hurt by Alex and Wilfred and Donovan is now bringing all those things into, I know he's going to, but he's not like that. So heal, find a way to heal. This is so important because recently I was talking to a gentleman who had been in a relationship that didn't work, and I smiled. I've been there, done that. I got the t-shirt, and I had a few words to say to him. Heal. Because if you don't heal, you will hurt yourself and you will hurt people. The other thing is, don't isolate yourself. Like I like what we're doing here today, talking to our community, talking to each other, making sure that we're looking after ourselves and addressing one another's needs. And I've said this, if all your friends look like you, talk like you, think like you, you're more likely to be racist and parochial in your thinking. As a matter of fact, you're less likely to succeed in life. I'll say that again. If all your friends look like you, talk like you, they think like you, you are more likely to be racist, you're more likely to be narrow-minded, and you're less likely to succeed in life. That's my own personal belief. That's why I put my name there. All right, you can quote me and come and fight me in my house if you like. But that has been my experience over these few decades. So action points. Sleep is very important to how our mind recovers. Sometimes we overdo it and we go into overdrive, we go into hyperdrive, and then we don't get what we need to recover well. Work-life balance, again, is very important. Read. So I talked about the fact that, look, you have to expose yourself. The difference between success and failure many times is not how hard you work, it's the information that you have. If you don't have the right information, you're not likely to succeed. I don't care what field you're in. The difference between success and failure is not hard work. It's not your race. It's not your color. Sometimes it's not even your environment. Of course, environment matters, but the difference is information. Because you can be in the right environment. If you have the wrong information, you're not likely to succeed. You can be in the wrong environment, but if you have the right information, you succeed. We held a leadership seminar just a couple of weeks back. I happened to meet a couple of young men who do business in Nigeria. And Nigeria is a very hostile environment for business. For those of you that don't know, there's a lot of corruption. But just in the first quarter of this year, they have turned over in local currency over 1.4 billion in sales. That's the equivalent of over, nearly 300, 500,000 pounds in first quarter. They're in a hostile environment, but they're not allowing the environment to affect them. So read, travel, by all means, do what you need to do. Let me go back again to the number 6, or the last point there. Heal. If you don't heal from past mistakes, past experiences, past hurts, you will not be able to find happiness going forward. Forgive yourself and forgive the perpetrator as well. Yeah, because sometimes we talk about forgiveness, and my experience is that sometimes people are even able to forgive the people that hurt them. But some of us don't forgive ourselves. We hold ourselves so accountable. In fact, it's unconscious. Many times it's unconscious, because when you talk to people, by the time I finish speaking to them, I find out, because I'm going to be I'm starting a coaching academy soon. This is just on the side. I want to do, because I found out that there's a lot of need. There's a lot of people who are hurting, who you've got issues. Part of the thing that you've not forgiven yourself. How did I allow them to deceive me like that? It's all part of it. But forgive. Otherwise, like I said, if you don't heal, you hurt people. You hurt yourself, you hurt people. Take positive steps towards your future. I often say this: you can either be bitter or you can be better. It's your choice. You can choose to be bitter or you can choose to be better. I always choose to be better. People have hurt me. My best friend hurt me, and I choose to be better. As a matter, one Jamaican lady said to me years ago, I must have been 20 odd years ago, maybe 25 years ago, that if nobody has ever betrayed you, you've not lived long enough. So someone's going to do something. Someone's going to step on your toes. Someone's going to steal your carrot cake. Someone's going to decide to support Arsenal. I don't know why, but someone's going to do something that will upset you. and you can choose to either be bitter or be better. Your choice. Study, reinvent yourself, redefine yourself, re-educate yourself. Take positive steps towards your future. Your past is your past. Acknowledge that something bad has happened, but don't allow it to define you. I'm sorry, but I hear this thing on social media, people who, I'm a single mom and all of that. Who cares? I'm sorry, but why do I need all that information? And you're starting a single moms club and all of that. Please, whatever has happened has happened. Don't allow it to define you. Somebody said, divorcee group. Now, while divorce is traumatic and painful and all of that, why are you marking yourself as a divorcee? You're a beautiful young woman. I saw this in a CSI movie. I watch a lot of crime things. That's my thing. My wife does the romantic comedy. I do crime. So we all do things differently. She made me watch a few romantic comedies. That's how you stay married for nearly 20 years. But anyway, this I saw in a CSI series. It says scars tell us where we've been, but scars don't determine where we're going. A scar may tell us where you've been. Yeah, you've had some trauma. Acknowledge it. As a matter of fact, I often tell my patients that don't shy away from what happened to you. Whatever happened to you was bad. All right? Somebody did something to you, or you did something. It's bad. However, that's not now your new name. I had a lady who performed an abortion in her teenage years. Till she, in her 30s, it was still, and she couldn't conceive. There was nothing wrong with her. Got married to a lovely man. She couldn't conceive because of the pain and the guilt. So we had to talk her out of it. Don't allow the past hurt to define you. Scars may tell us where you've been, but it doesn't determine where you're. Of course, seek professional help, counseling, therapy, speak to your GP, mental health practitioners, etc. I think I've spoken enough because I could speak till tomorrow if you let me. I don't intend to do that. But like I said, this topic is really so broad that I just thought, you know what, I'll do a brief overview and then we can have a quick chat. Thank you.
Thank you so much, Dr. Joe. And as ever, so many thought-provoking things there. And I'm sure that people will be coming in with more of their questions because I've had a lot coming in already. And it's really interesting just to say to people, just before we all came on, we have some time to chat before we start. And we talked about spirituality and the fact that it can mean different things to different people, and it can be a big part of many people's lives, and particularly within our communities, but it isn't really talked about. And we also reflected that Dr. Joe, as he's talked about many of his hats, but one of his pastoral hats, he's somewhat biased in that perspective, but didn't want to actually bring it out independently. But as ever, we said we will wait for people to engage, because I'm sure people will bring it up. And sure as ever, someone has brought it up. So it's absolutely fantastic that people are listening so eagerly, and Dr. Joe, that you're fully in tune with people's needs. So the first question, how do we as a community get non-Black healthcare professionals to understand the spirituality of our communities? And referring to very early on one of your slides and how you talk to it, it's part of our person and our perspective. And I think that's beautifully put, whoever put that question.
Thank you, Vanessa. I think it's a really good question, and it's a valid point. So part of the work that CAN does, we have teamed up with the program that's been run called the Black Health Improvement Program. We've teamed up with some other groups, health professionals, and we're actually actively now running programs in GP surgeries and in hospital to talk to them about the peculiarities of how Black and ethnic minority people perceive things, including spirituality. We just have to keep educating them, Vanessa. We have to keep nudging away. This is why I love the work that CAN is doing. And so they've actually come to my surgery in Rochdale. We've had that talk, and we're pushing it into as many spaces as possible to make sure that non-Black people, because even there are some Black people, believe it or not, Vanessa, Black professionals who also don't understand how deep-seated some of these spiritual beliefs are. And so we deliberately set that up, and we're doing that. Sadly, there's only so much you can do within a space of time. But slowly but surely, we're trying to change that perception. Every opportunity we get, even this talk, is also part of the way of exposing things, because a lot of people watch this on YouTube and Facebook afterwards. But we just have to keep educating them and making sure that they're aware.
Apologies. Thank you so much. I think it's really reassuring to know that, first of all, that problem is recognized and there are projects that are going on to address it. But as you say, there is so much more to do. And one of the things I think with this is that, as individuals within our community, getting involved within patient panels and things like that, to say that we want more healthcare professionals to understand our lived experience in a different way is really important, because that's exactly why the project that you talk about with Khan, how that evolved, because they saw a very, very clear need. So thank you so much. And I think, again, a couple of questions that have come through to me privately as well, and it's very much of the same ilk. So I'm going to bring some of them together.
Sure.
But I'll also strip them out. But it's the one question related to the fact that, saying that I'm a young Black woman, and I've seen all the women in my life be really strong and fit that strong Black woman persona. And I've recently been diagnosed, for this specific person, recently been diagnosed with a chronic illness. And I am deeply, deeply saddened and fed up by this, but too ashamed to talk about it because I'm surrounded by so many strong Black women. How do I strengthen my mindset?
Excellent question.
Really
I think it ties in very nicely with the last points that I made. Because we see this every day in clinic, especially with Black ethnic minority people. I work in a place where there's a lot of Asian community, and the problems are the same. So here's the thing. You have to acknowledge the fact that there is a problem. Part of the road to recovery is embracing the fact that, you know what, this is a problem. Let me switch. Since you mentioned about my spirituality, I might as well own it. I often tell people that, the Bible says faith calls those things that be not as though they are, not the things that are as though they are not. Faith calls the things that are not as though they are, not the things that are as though they're not. In other words, if you've got a big head, you've got a big head. Faith is not going to make it any smaller. You've got a big head. Own it. I have big ears. My big ears have been working for me. They helped me to pass through medical school and to navigate many difficult issues. So I'm saying this humorously to explain the fact that you have to appreciate the fact that this is the problem, or there is a problem. Now that you've got that problem, don't be a superhero because you are not. Don't follow the trend of the people around you. It's a mistake, because eventually, no matter how big and how strong you are, you will snap, because there's only so much you can take. This is why I specifically said at the very last slide, seek professional help. Get as much help as possible to heal and to move away from whatever that problem is. I've had the privilege of talking to people with chronic illnesses, polymyalgia, MS, things like that. Most of the people that recover best are people that embrace the fact that this is the problem, these are my limitations, but also they don't allow those limitations to stop them, not by being braggadocious or being excessively strong, but actually embracing the weakness and understanding that, you know what, I need help to be the first step to recovery is being able to understand that I need help to deal with it. If you don't acknowledge the fact that you need help, you will not be able to attract the kind of help that you need. Sometimes the help that you need is not necessarily a medication. The help that you need could be an encouragement. The help that you need could be someone coming alongside you and partnering with you and saying, you know what, you're not alone. The help that you need could be somebody who has been through that situation and then coming to tell their story to encourage you. I lost my brother in final year. He died under mysterious circumstances. One of the things that helped me to be able to coach other people who have lost, who have had a loss in their family, is that I have been in that situation. I understand. I have sat where you sat. One lady cried on the phone with me for 2 hours because she was trying to be excessively strong. She'd lost a sibling and was trying her best to be strong until it nearly broke her, I think mentally and physically. She had 2 children to look after and she couldn't do it. But by the time I finished speaking to her, in fact, her pastor called me to thank me because I explained to her that you're doing this the wrong way. You've experienced something bad has happened. So don't try and cover it up by saying, oh, it is well, it is well. Sometimes you just have to say it is not well right now. But you know what? It's going to be well. Like the Korean movie, It's Okay Not to Be Okay. There's a movie like that on Netflix. It's okay not to be okay. So we need to acknowledge the fact that there's a point in time in our lives where we are not okay. However, my talk today is to say, while you are saying, yes, it's not okay, you're not okay at the moment, but don't stay there. Take positive steps moving away from it. That's the only way you're going to be able to deal with it. I hope that answered the question, so.
No, thank you. A really powerful answer. I was just reflecting on your points about if you're not open about what you're going through, you're not going to get the help that you need. And unfortunately, what I often see with friends, family, all around us, is that when it isn't acknowledged, it manifests in so many different ways later. As you say, you can have Shannon showing a certain part of her personality in her relationship, and her partner not really understanding. It's not even about him. It's about someone years previously, or her father, or an uncle. And these things haven't been unpackaged. So important, as you say, to be open so you can get the help that you need. Another really important question related to the diagnosis of ADHD, which we are seeing more and more of, as we've reflected about actually last week, was what are some of the practical tips for maintaining a positive mindset during physical health recovery? But having ADHD that makes me quite down sometimes. So again, thank you for offering that question and that personal reflection. And it's about, trying to keep positive, but then you've got something else going on as part of an illness or related to you that is bringing you down. So it's one's pushing you one way and one's pulling you in another.
I think it's a really good question. I think it's really difficult. It's tricky, but not insurmountable. And this is where getting the right kind of help matters. You see, if you fight alone, you may succeed to a certain degree. But if you fight with other people, you find out that your chances of succeeding are exponentially increased. I'll tell you some of the experiences that I had. I came to this country as an immigrant, because I tell this to my church all the time. And I was privileged to be mentored by an older gentleman who's an anesthetist. And then I had another lady who happened to be a pharmacist. And then I had another gentleman who is a cardiologist. Now, somebody was making fun of me that all your friends, all the people you surround yourself with are older, wiser people. Very intentional. There's an old African proverb that the man who is on the journey and learns to ask for directions is less likely to lose his way. So you find out that when you're going through difficulty, when I'm going through difficulty, if we isolate ourselves, in this society, we delude ourselves that we are all self-sufficient, I'm all that, you don't want to ask your neighbor for help and all of that. I thank God for my street. They share strawberries and apples and things like that where I live. But there's this thing where we have this self-sufficient idea. It doesn't work, especially when it comes to your health and when you're going through stuff. Research has shown people who go to church, people who go to the mosque, people who go to some sort of spiritual gathering are more likely to recover better from illnesses than people who don't go anywhere. Why? They have a big support system. When my wife delivered our babies, all of them, in fact, we went to honor the lady recently, somebody was cooking pepper soup, somebody was making porridge, somebody was making hot water for her, somebody was massaging her feet. We were like, whoa. I'm like, excuse me, the father was involved in this. Don't I get anything? You know, when you have a good support system, it automatically aids how well you recover. So what I would say to that person is make sure that you find a good support system, because you can't fight your battles alone. You can fight, you can try, but you're less likely to succeed, and you may come with a Pyrrhic victory where you're coming, you're injured and all of that. But if you have a good support system, it aids. So what I would say, it's a difficult situation, and all these things come to test us. I say to my patients with depression that depression is like going through a tunnel. As long as you keep moving, keep going forward, there's light at the end of the tunnel. And I hope that helps.
Thank you. So again, no, definitely, Dr. Joe, just really important reflections and affirmations for people to kind of play back in their minds about really seeking that community and being open to community, because I often say to patients that there are there are more and more spaces and opportunities for people to create a community, and even though many community organizations don't have enough funds, I always feel they do amazing things in the community. But you as an individual, you have to make a decision in the morning that I'm going to go to that event and I'm going to go to that group on Thursday night and I'm going to meet people there. And then when I meet them, I'm going to open up a bit of myself so that people can give you the support and kindness that you need. And I'm not underestimating people's concerns and anxieties about it, but we also have a responsibility to allow ourselves to be helped as well. So
you hit the nail on the head, Vanessa. I think part of the problem, because I was saying this to Ngozi and I think to Faye, we were having a meeting, and I said, look, part of the problem within our community specifically is that even though we have issues, some of us may have issues, we don't know how to open up. Because it's not, you see, part of it is the stigma and you're worried about how people are going to receive you. This is why, again, it's important who you open up to and in what space you open up to. I'm not asking you to just open up to just anybody, because people may misinterpret and mistreat that. Go to the right places where you need. Go to your pastor, go to your GP, go and get the right kind of help. But part of it, like you were saying, Vanessa, is us being willing to be vulnerable and to say, look, you know what? I do have a problem. I can't feed my children. I'm going to food banks. What can I do? Because when we've organized, feeding people and what do they call it? Like food pots and things like that. People who need some of those things don't even come for it. Yeah. So sometimes I have found myself as a pastor, and this is just being real, I've had to take food to people's houses because I know they won't come. Yeah. And I know that they have the need. Mm. Now, just assume that I too am cocky and I'm like, well, they don't come. No. We can't all be angry at the same time. Black people, we know how to be angry, black people, but we can't. So we have to cross some of those bridges one at a time. And we have to be truthful to ourselves. This is why specifically I made that comment. I'm surprised no one has asked the question about that. People often assume that there are smart people and then there are not so many smart people. I don't sincerely believe that. I believe that all of us are born with a clean slate. Now, of course, genetics play the part in how, but if you think about it, Vanessa, and I'm sorry to use you as an example, you're beautiful, you're educated, and all of that. See, the fact is that I'm sure your husband agrees with me. You're more likely to bring up educated, smart children. Mm-hmm. And this is why I was talking about how environment is so important. It's so important that we create, and this is one of the things we do with CAN, with other organizations that I partner with. We try to create the right environment, especially for young people. I'm very passionate about young people because their brain is still developing. We have to create that environment. We have to give them something to see. I run a mentoring project. I might mention this while I'm here. We started off with 3 children pre-pandemic. We now have 120 teenagers that I connect with once every 3 months. What are we trying to do? I bring in professionals, accountants, lawyers. I want these children to see a different perspective, a different future for themselves. Because if they can't see their way out, if all they can see is the drug dealer in the corner riding a bike, if all they can see is the guy who's been in and out of jail, if all they can see is the discrimination and the put down that they get in school, then guess what? That's what they're going to be. And that has been going on and on. It's like a cycle of trauma. But now you want to change the paradigm and say, look, you can be a postman, you can be a teacher, you can be a nurse, you can be, you can be a gynecologist. One young man, this is a very good example, and I know I'm talking a lot, but with this one very good example, this young man was about to be expelled from school. Real life story. Single mom, lovely lady, tried her best, doing everything she can. She was about, so they connected them with me. Somebody connected them to me, and for the first 3 occasions, the woman was thinking, what is he doing? I will just take this boy, go to the house, and we'll go on a walk. Sometimes I'll just buy him coffee. We sit down, we eat cake. I did not say a word. We just talk about football. By the 4th time, and I started asking him, what's wrong with you? Long story short, the young man is on course now to go study something in school. He's about to go study, I don't know what he's going to study, medicine, pharmacy. He told his mom that he wants to be a pastor and a doctor like Dr. Joe. What changed for him? He saw something different. If we can change the narrative, if we can change the perspective, if we can change the what people see, the mindset, then they can see something different. And so one of the things that I try to do is we have to change people's paradigm. There are some people that, they do miracles and crusades and all. That's good. That's fine. They're the good healers. Mine is we'll work on people's mind, because I have learned a long time ago that if your mind is not in order, whatever else is happening is not good. All right. Thank you. I'll leave that. I just wanted to chip that in while we're on the subject.
No, I just you're making me think so much, and I'm sure so many people on the call, and we never have enough of these types of conversations, because we talk about representation and we always say you can't be what you can't see, and etc. But there's a certain apathy that can sometimes happen if you are not who you wanted to be, and you have children that you want them to be something else, but you are not even sure how to get there. And you're thinking very much, as you've said, Dr. Joe, that you make an assumption that someone like yourself or myself, with the background that we've had, it's an assumption that our kids will be fine. So if I'm not anywhere near what they're doing, what will happen to my kids? And it's so important that we challenge this mindset and say that we cannot be defined by who we are or where we are now. And there are more and more spaces and opportunities to affect that change. So things like your mentoring group, there are more and more opportunities like that, and to give people the support that they need, or they may not even realize they need. So I think, and I'm getting lots of private messages about this, so thank you. I think you hit a really important spot in people's mindset, so thank you so much. They're coming through thick and fast, but I wanted to slightly pick up on what we've just been talking about, because you mentioned earlier about your experiences as a governor, and the systemic racism, systemic labeling within education, and how to challenge this. And I think it feeds onto what you just said. So there are just a couple of questions to say, how do we challenge this? And the summary of it is, how do we as parents have the strength to challenge this and maintain a positive mindset when the system that our children are exposed to, often more than us during the day, are really having a really negative effect?
Yeah, that's a really good question. So one of the things that I often I've found even in the short time of the governor and all of that, and even before that, we don't often represent ourselves well. You know, we go there, we're shouting, we're angry. You know, first and foremost, you see, Vanessa, what I have learned, and I totally hear what you're saying, because when I had my son, I was petrified. I was like, I don't know how to be a dad. You know, what am I? I was terrified. You know, and only my wife knew. I had to pray. I don't know how. I'm not perfect. So what am I going to teach him? You know what I'm saying? So, but as I found out that I realized that I had to educate myself. I read books. I spoke to my own dad. I became closer to my dad when I had children. Now, the thing about it is that in terms of what I have found is that there's intelligent quotient, your IQ. There's emotional quotient, your EQ. In other words, how to be, how to behave yourself. You don't wear bikinis to an interview, especially unless you are, you're positioning for a lifeguard. And even then, you don't wear shorts. You don't wear a three-piece suit to the beach. That's emotional intelligence. But there's also cultural intelligence. What I have found in a lot of us Black people is we don't understand cultural intelligence. We don't know how to behave appropriately in certain things. Either we overdo it or we underplay. So going back to what I found being a governor is that, look, the way to go about it is, number one, be interested in what happens in your children's school. Make time for the parents' evenings, find out what's happening. Because, see, the mindset of the average Caucasian, the average English person, to be fair, is that if you don't show any interest, then you're not interested. They won't bother you. It's all over the place. You've been in there. If you don't show interest, they won't bother you. But if you show interest, then the antenna goes up and they're like, oh, okay, this person is interested. We have to be on our toes. And, that's what it is. But even though and having showed interest, you have to show interest in the right way. You can't go there and be the stereotypical angry Black man or angry Black woman. Ask the right questions. One of my mentors used to say that the reason why people don't get what they want is that they ask the wrong questions. You ask the wrong question. Why is my child not doing well? That's the wrong question. So he's failed the exam. What are the areas where he's weak? How do we correct this? That's the right question. So you can see two totally different things. You are talking to the teacher, but you're saying two different things. So it's really important that we, especially when it comes to, I'm passionate about education as well, but generally I'm passionate about young people. See, the thing is that we need to understand that we're in a society that doesn't understand us. Let's not make it more difficult for ourselves. Our culture is different. For goodness sake, our food is different. Even the way we dance, the way we praise God. You've been to some Black churches, when I say, you know how it is. we don't play. We get it down. And I've been to some of my friends' churches, white churches, and they're solemn. And I'm like, why are they standing still? And why didn't, when I initially came to the country, are they afraid God is going to be, if they shout, You have to understand where we are in. And it's such an interesting conversation we're having today. So, but the bottom line is that when you're faced with those situations, if you don't know how to approach it, find somebody who does. I have silently slipped in the fact that I have mentors. I have mentors in several different areas. I'm so blessed that when I came to the country, I had people who took interest in me. See, mentors are not, you don't go to somebody and say, be my mentor. You see something that you like and you pursue it. This person is doing something right. How do I also get to do something right? I met some of these people in house fellowship in a church. It wasn't an official gathering. I met some of them at work. There's a Muslim gentleman who took me under his wings. I later on found out that I went to school with his wife, believe it or not. But he just saw me. The same thing I've done for other young Black doctors. I saw this Black guy, he was being oppressed, he was being used basically by the hospital. So I took him, called him aside. Oh boy, what did they worry you? What are you doing? I spoke like that so that nobody else will understand what we're saying. you know. And by the time I finished speaking to him, the guy, went on to become a GP, excelled, even helped him with immigration and everything. So the point is, there are people who have gone ahead of you, who know, who understand your situation. There's information out there. It's how you access it. Ask the right questions. If you don't ask the right questions or ask the right people the right questions, you won't get the right answer. Thank you.
Thank you, Dr. Joe. And it's I just want to also thank everyone for your questions and your engagement, because this is why we love doing it. And we also want to make sure that we are asking and exploring the right aspects of the topic, and we can only do that if you get involved. So again, thank you so much to everyone. And there is there are these reflections in the chat, Dr. Joe, and I think it's important to acknowledge them. So the fact that you can try and ask the right questions, you can try and maintain the positive mindset, but the system is very difficult, and I think for many, and I don't think I just want people to recognize we're not dismissing that. What we're emphasizing is, how do you keep going in a system that is against you, as you said, Dr. Joe. So just wanted to acknowledge that there. And someone's said something very interesting, and has been alluded to me in other contexts about their concern about opening up and trusting people with things, saying that sometimes someone's written that information that is used, that is submitted during conversations, can come under some data or safeguarding categories, and they've found concern that it can be misunderstood or taken out of context later. So I'm presuming in the legal system, so divorce proceedings or child protection proceedings, education authority, insurance, etc. So I just wondered if you could just comment on that, and acknowledging that there is always that possibility in certain contexts, but how would you support someone with this concern?
Well, that's a really good concern and a really good question. The thing is, first and foremost, before you begin to divulge personal information, you need to ascertain the fact that this conversation, is it being recorded? If it's being recorded, how is it going to be used? Number two, is this a confidential conversation? Because if you don't ascertain that, then they can then assume. But generally speaking, most of these conversations are they are confidential anyway, especially when it comes to health. I don't know about the legal aspect of things. So you have to protect yourself. And this is a really good point to say, it's really important. Don't just go tell your issues to anybody. So this is one of the main reasons, Vanessa, why CAN was set up in the first place. And I'm not being biased or anything, but we have had situations where people have spoken to social workers, Caucasian social workers. They've taken the issue and they've run with it and they've blown it beyond proportion. I have a very good example, a very lovely lady who happens to be a Black social worker. This is one of the reasons why you and I, you guys and I, we all need to get into, aspire to these positions. Black social worker was brought into a situation, a so-called difficult situation. She simply looked at it. What was the issue? The mom wakes up at midnight to pray. And it became a social issue that she's not allowing the children to sleep. I said, no, this is what they believe. This is part of their spiritual beliefs. That matter was immediately ended just because a Black and understanding social worker was involved. So please be very careful who you open up to and how you open up to people. It's really important. So that's kind of like, I'll peg it there because there's a lot that can be said about that. But even among, you need to understand who's on your side. And if you're unsure, make sure you get legal representation. But one of the things that CAN was set up for, because we've got an advocacy department, I think Natasha and Sam will tell us more about them. There are organizations like CAN, and I'm not just saying it because CAN is here, but I volunteered to be a part of CAN because I saw there's an advocacy part where you can have legal representation. If you're going through stuff, you can have health professionals like Vanessa and some other people who will help you go through stuff. Don't suffer in silence. This is what we're here for, to help one another navigate some of these tricky waters and to make sure you're not alone.
Thank you so much, Dr. Joe. I'm going to do one last question. It's a debate that we often have in my family between myself and my cousins. So I'd love to know your viewpoint on it. Is it possible that some people are naturally born with a positive mindset and others are born with a negative mindset? And I just disclaimer to my family, I did not put that in. Someone has put that in the chat.
That's a really good question. I don't think anybody is born with any particular mindset, but I do think that we all have different personality types, and some personality types are more prone to being positive compared to others. So yes. So for example, according to Sigmund Freud, if there's time, you have 4 main personalities. There are other modules. You have the phlegmatics, you have the cholerics, you have the melancholics, and you have the sanguines. People who are choleric, go-getters, boisterous, they're a lot more likely to be positive. So your personality type, rather than genetics, rather than being born, determines whether you're going to be positive or not. I happen to have a sort of a melancholy personality mixed with. People often have 2. I think we should do this in a separate session, but people often have 2 combining with each other. My melancholy mindset, I used to have a very negative mindset, believe it or not. And I used to be shy. I couldn't even talk to people. I used to stammer. When I told my wife, she was like, never. Growing up as a young teenager, I was awkward. I was shy. I was negative in my mindset. But what changed? You see, I often tell people in my church, you will remain the same person you are 5 years from now, apart from the people you meet, the places you go, and the books that you read. The people you meet, the places you go, and the books that you have to change. You have to expand your mind. If you keep on mingling with people of negative mindset, guess what? You will be negative. I used to have a really negative mindset. I can't believe it now, to be honest with you. I don't even know who that person is. I can't recognize them. That's my old self. But I changed completely. So there is nature versus nurture and all of that, but it's about personality rather than being born. Like I said, the brain is a blank slate. And then your environment now begins to affect things, and also what is put on the inside of it. So I hope that helps.
It helps, very much so, and helps my discussion. So thank you so much, Dr. Joe. I want to say a huge thank you, and I do not take it lightly. It's been a fantastic conversation, and I'm reflecting. You never think if titles do it justice, because we started in one place and we've gone to a much broader place, but a much needed place as well. So thank you for your time. Thank you for your insights, and thank you for your honesty and openness, because I think that's what makes such a tremendous difference. And a huge thank you to everyone that's been listening, that's been engaging. It's been such a great morning. And I'm now going to hand over to the wonderful Natasha Khan for the announcements. But thank you so much to everyone. Thank you, and have a lovely afternoon. Natasha, over. There we are.
Hello, hi. I couldn't see myself. Hello, and thank you so much, Dr. Vanessa, for introducing me like that first time. Thank you, Dr. Joe, for a great session. It's always, like Dr. Vanessa said, it's always so interesting to see where the topic starts and ends, and the engagement has been really overwhelming and overpouring, more the term. People really felt seen and comfortable to share their own personal stories. So thank you, Dr. Vanessa, as well, for hosting and guiding us through this. And again, it's good to remind ourselves that the doctors that are in Health Hour, they volunteer their time completely free to just be with us and really improve the health literacy of our communities. So yes, so let me just share my screen with yourselves. Apologies, only have one screen today. It should be fine. Okay. Seconds. Perfect. So we do have health hour every single Saturday. This at 11 a.m. So the 20th of April will be no different. We'll be here once again, talking in very interesting topics about health, always focus on Black people and their particular challenges and complexities. So I do hope to see you next week. We have every week Healthy Heart every Tuesday at 6:30 p.m. We look to have a, overarching approach to health. So not just talking about health and make people aware of certain things, but also, nutrition. How can we help you, know more about your nutrition, about your diet and lifestyle? And again, this is all tailored to Black people and hosted by Black nutritionists. At the end of it, we have a physical activity as well. So I'll look forward to see you on Tuesday at 6:30. And how is your lung health going? So we're really urging people between 55 and 74 in the areas of Enfield, Camden, Haringey, Islington, basically North London, to look into their letterboxes or emails and check if you weren't one of those 14,000 people that received there is a number of people that have received an invite to go for free and painless health check, but 14,000 people already signed up. So do join the movement. I always put all the links of the things I'm talking about ahead on the chat. So if you need anything, it's there. Homes for Health. So we're really speaking to the people in Gorton that are interested in making private house conditions better. Together, we make change quicker and more efficiently. So we're really talking to yourselves that live in Gordon and rent privately to reach out to us. We really want to hear from you. We're looking to create a residents forum in Gorton to really address some issues related to housing and health. What changes can we create on the long term for people living in Gorton? So do get in touch with our advocacy team. The link to register is on the chat. And tomorrow we are in London with the London Inspire Program Health Fair. So we are having we have a few actually of these fairs already. We had the last one in March. So again, you can have completely free of charge health checks, blood pressure, diabetes, lifestyle advice. I myself did it in London the last March, and it was really good to know that I'm in good health. But every year I'll take the opportunity to do it again. So do join us. You can just show up or you can contact the number on the screen. Also, we are involved with Cadent. We have a project called Resilient Informed Black Community, apologies, and is very focused on safely, efficiently, and affordably using energy. We are giving a range of free household items. You can imagine slow cookers, blankets, heated blankets, but we're also giving advice, giving guidance, carbon monoxide alarms. There is a lot to be gained from engaging with this project. If you are from Manchester, there is a contact there for Michelle. And if you are from London, we also have hubs there from Bernice. They are doing drop-in sessions as well. So come and engage with us. And it's that time again. Africa Day is fast approaching. Obviously, it's on the 25th of May, but we're now celebrating it for a second year. This year, we're doing it in the University of Bolton on the 24th of May, the Friday. It's very much focused on African businesses and their relationships with the UK and how to grow, how to expand your business. So all of these things will be approached during the event. One very key point about this event is that stalls are completely free of charge for African businesses. We do have only a limited amount of stalls, honestly. So obviously anyone can attend as an attendee, but if you want a stall, it's time to register now, and the link is on the chat. Thank you so much for joining us once more to Health Hour, and I hope to see you next week.